We encountered a patient with an upper respiratory tract infection that progressed to a life-threatening illness that could kill him in 30 days. All the standard medical therapies had failed. We had one last-ditch effort to save his life. So, P.A. Owens, tell us about this 65-year-old man who had this upper respiratory tract infection.
So he was having this symptoms of an infection that had been getting worse for several weeks, and he saw his primary care doctor, who put him on an antibiotic and ordered a chest x-ray, and we told him to maintain that follow-up with that doctor.
Unfortunately, this gets much more complex.
After the first antibiotic, he went to the emergency room because he was feeling worse, and the chest x-ray showed fluid buildup in the lungs. He was left with the second antibiotic, but after 48 hours, he went back. He was feeling worse. The chest x-ray is continuing to get worse as well, and he was given a third antibiotic. And now he presented to us looking terrified. He was very ill and out of breath.
This is terrible. This patient needs to be admitted to the hospital. And in fact, we recommended just that. However, he refused. Our concern was this a potentially life-threatening decision? Although it was our decision to admit this patient, he refused. So we tried this approach.
So we gave him a one-time dose of steroids to reduce inflammation. We gave him nattokinase, an enzyme that breaks down blood clots. Serrapeptase, a different enzyme that breaks down inflammatory tissue, and liposomal curcumin, which comes from the turmeric spice and helps break down inflammation and boost the immune system.
And lastly, we prescribed a defined plant-based diet, which also reduces inflammation, enhances the nutritional value, improved microbiome, and we were hopeful that this approach will be very beneficial. However, we were concerned that it would be too late, and we still were worried that this decision could cost him his life.
Upon his return, about 2 weeks later, he was very concerned because he had increased coughing. He was coughing up more mucus and now blood. A CT scan was done, and that showed a large pus pocket around the lung, and a doctor had tried to drain it with a needle but was unsuccessful.
Wow. This is tricky because these progressive symptoms could represent a detox effect, or it could represent worsening of his condition. Oftentimes, individuals with inflammation in the lungs, when their body is starting to detox or cleanse, you can have more coughing of mucus and sometimes even blood as the body's trying to heal. We see this frequently in smokers. Oftentimes, chronic smokers who stop smoking will have increased coughing and even increased mucus production as their lungs are healing. So this could be a factor in this patient's condition. However, we don't know whether this is a detox reaction or his condition may be worsening. So we're not out of the woods yet.
The patient returned after 1 month of an aggressive anti-inflammatory regimen, and for the first time, he experienced a positive breakthrough. His coughing subsided, and his energy had increased dramatically. He was beginning to feel alive again, and he and his wife were showing hope.
Wow. So we repeated a CT scan. What do you think it'll show? So upon his return several weeks later, he was feeling even better. He had much more energy, he was exercising, and he and his wife were ecstatic. The coughing had nearly totally subsided, with decreased mucus production and no more blood production. He had a new lease on life.
The repeat CT scan showed resolution of the fluid around the lungs, and the pus pocket was nearly undetectable. Also, the white blood cell count went down from 20,000 to 4,000.
Wow. So these findings are consistent with the clinical findings, which is really important because it's always important that the patient's clinical findings and the test results coincide. So the question is, what really happened? What I think was going on with this patient was a condition known as post-infection inflammation. It's very common that after an acute inflammation, an individual can have a severe an overwhelming autoimmune response. Essentially, your immune system responds to the infection immediately. The immune system can kill the infection. However, the immune system can be overwhelming to the body. If the body doesn't have the ability to turn the immune system off, you can have an overwhelming inflammatory condition. In the case of the lung, if somebody gets an upper respiratory tract infection that infects the lung, you can have an overwhelming autoimmune response in the lung, which creates a condition known as ARDS, acute respiratory distress syndrome. This condition can spread to the entire body, which can cause a condition known as sepsis. So we frequently have individuals that come in with an acute lung infection or an acute infection of some other type. And after we treat the infection, the lasting effects could be an overwhelming inflammatory response, which ends up being the thing that kills the patient. Many of us remembered in the recent pandemic, individuals who had the coronavirus infection often ended up on ventilators, often having conditions known as ARDS or sepsis syndrome. This wasn't just the infection itself, but it was an overwhelming inflammatory condition that went out of control that resulted in the demise of a patient. In this case, this overwhelming inflammatory condition nearly took over his lungs and nearly took his life. Fortunately, we aggressively treated the inflammatory condition with aggressive and powerful anti-inflammatory therapies, such as the curcumin, serrapeptase, and the defined plant-based diet. And this proved to be very effective, as you can see in this case. So what are your key takeaways from this case?
So we did not focus on the disease. We did not talk about the potential bad outcomes with the patient. We focused solely on the intention of getting him better.
So there you have it. This patient started with a pair of lungs filled with pus to a heart filled with hope. I hope you enjoyed this segment. Thanks for watching. If you got value out of this video, please like it, subscribe, and hit the notification button to see our next show.